This third presentation this morning is about managing violence in the workplace. Y'all ever heard the term going postal? Okay, going postal. So, before I show you this, I want y'all just to kind of picture this in your mind. When we've gone back and studied cases of where people have gone postal at work, the myth was that they had lost everything and had nothing left to live for and whatnot. And when we found out, you know what they'd lost? They had lost a promotion that they thought they wanted. Well, not about this promotion that they wanted, that job changed every 3 or 4 months because it was so hectic and so demanded, nobody wanted to keep it. And the job's going to be available again in another 3 or 4 months. So we found out that many times people have a myth that if they don't get the vacation when they want it, they don't get a pay increase when they want it, don't get a bonus, or don't get a shift change or something, they think they've lost everything. And they haven't lost everything, and they overreact to it. So the deal is that's something I'd like for y'all to bear in mind at work. Most of the time when people go postal or whatnot, they've just really exaggerated something and they've overreacted to it. I'd like for you to watch this. I may not show you all of this because if it gets a little too long, I'm just going to cut it off. But I want you to see the main point and to realize how people can get so worked up and overreact that they end up harming other people and also wrecking their own lives. So I'm going to try to play this for you.
It wasn't right.
You see this? You hear it?
He said, you just take this stuff and get on out of this office and don't come back, you're laid off. I said, fine, I will get even with you. And I left. Started getting angry with myself because I could not go out there and work. So I just walked in and I yelled, hey, I want to talk to you. You're not just going to blow me off like a piece of trash or something. We're going to talk. And the next thing you know, there's a shotgun there. It goes off, and he dropped to the floor dead.
We live in a violent culture, and unfortunately, it is an increasingly violent culture. But the violence that we found in the streets has now opened the door and walked through into the workplace.
For women, the #1 cause of death in the workplace is homicide. For men, the #2 cause for death in the workplace is workplace homicide. For every single one of these situations, there's an untold cost, and that is the psychological trauma that comes with not only an incident of workplace violence, but the threat of workplace violence. We need within the employer's environment to change our sensitivities toward the whole issue of workplace violence and threats of violence, and much like with the field of sexual harassment, establish a standard that it's not okay to tolerate or to make indirect or direct threats of violence.
We know now that there are 2 types of workplace violence. First is in which the individual is making threats of violence and actually intends to carry out that physical harm. The second is where the person is making threats of physical violence, but really intends to generate intimidation, fear, and emotional distress in coworkers.
It can be destruction of property. It can be a matter of tampering with a computer. It can be a matter of stalking, of phone calls, of infliction of emotional distress.
Learning about workplace violence and being able to manage it means that we have to understand that there are, in fact, common themes and common events which appear over and over again.
And whenever that's diagnosed, then that starts suggesting that there's something we can do to better predict early indications of a problem, and in turn, policies and steps that a company can take in making a difference.
In the situation we're about to see, some of those common themes and events will be illustrated. We need to understand that each situation has its unique characteristics. It needs to be evaluated on its own merits.
Word has come down. Starting tomorrow, we're going to get a lot more attention from quality control.
Oh, yeah, that's exactly what we do.
That's great. Hey, I know it's a pain, but component failure has gone up for the last 3 months in a row, and something is wrong someplace.
I tell you what's wrong. This is what's wrong. They can't keep this up.
Okay, look, here's the deal. A random sampling of your work is going to be reviewed in detail by QC. Some of your work will probably be kicked back more than usual. So
That is not quality control. That is spying. It's not right.
You both are going to be looking for another. Yeah, I'm going to be running this.
okay, are there any questions, real questions? Anybody? Okay, thank you. Thank you very much. Back to work, please.
Okay, all right.
Hey, Carl, you got a minute?
Yeah.
The individuals that we see involved in workplace violence are rarely new to the organization, nor do we generally find them at the very lower levels of the organization.
Generally, the person is a loner. They have a little bit of trouble or a lot of trouble relating to other people in the work environment. And don't be misled. Sometimes these people are very bright. Sometimes they're very articulate. But nonetheless, they very much tend to have their own isolation and distance, and that's usually felt by co-employees, usually felt very much by the immediate supervisor, the frontline manager.
Some people can maintain easier than other people can, no matter what the circumstances are. And others, they have no tolerance. On the surface, they look like a real mellow and easygoing person, but they have no tolerance.
A common myth is the idea that violence just happens, that someone snaps and all of a sudden you have a normal employee and the next day they bring in a semi-automatic weapon and shoot someone. Well, this rarely is a circumstance.
Have a seat. I just want to talk to you. I just want to make sure you're okay with this. You seem a little bit concerned to me.
Yeah, I was a little concerned.
Because it's wrong.
I know right. I know wrong. This is definitely wrong. And I think I got this thing figured out.
Okay, well, what is it, Carl?
I do good work.
You do good work.
I do good work, and they put on more pressure. It doesn't make sense. It's like they want to make people cry.
Wait a minute, Carl.
Furthermore, I think I know who's behind it.
Really?
The new guy, Brubaker, and that loudmouth in production.
You know what I think? Carl, I think you're blowing it way out of proportion. I really do.
They keep it up. Something's gonna happen.
You know what, Carl? I need your cooperation. Just give me a few days, and we'll see.
Come on, this is not about a few days. This is about pushing people. Pushing people too hard. People have their limits.
They feel there's something that they're entitled to, that the organization owes them. It may not be something that you or I would understand, but for them, it's a deeply held belief.
And that brings us down to kind of a core fundamental, and that is this sense of moral righteousness, a feeling that people have done them wrong.
When a person is this concerned with what's happening to them, it becomes difficult for them to perform their job. And so quite often you'll see a decline in productivity. They're having greater difficulties getting along with their coworkers. They have difficulty understanding instructions and supervision.
What's that?
Nothing's up. 3, 4, enter.
Here, let me see.
I said it's up. Why is this new keystroke is stupid? Whose idea was this?
It's just the new
It's
system.
not just a new system, it's another hoop. This is crap.
It's software, Carl.
Damn, this is not fair. God. It's Robinson, Brubaker, Montgomery.
John.
Oh, you don't think they're all in on it? Oh, wake up. You think we're all asleep?
What we will often see is somebody who has worked with a company for a fairly long time, and they've had a degree of success. They've had some very good performance evaluations in the past, but often their performance starts to ebb and problems start setting in, and they may be going through a performance evaluation where there are some questions starting to generate.
This company is in a lot of trouble, and nobody's doing anything about it.
John Montgomery was Carl's supervisor, and I was John's supervisor. Carl's reviews had been mostly satisfactory for the first several years he was with the company, but then he started to slip. John was concerned, so when Carl came up for review again, he asked me to sit in.
Which is exactly what they want you to do.
Wait, who is they?
I'm not the problem. Robinson's the problem. Brubaker's the problem. They're obsessed with these quarterly numbers.
Well, that's their job.
Yeah, well, you can't keep treating people like they're
Carl,
numbers.
maybe we can come back to that. But for the moment, let's look at your performance. That's why we're here, to discuss that.
If this company doesn't change,
Where with a regular employee, you might call them in your office and criticize them with regard to performance on a particular project or constructively give them help. With someone who's giving off these very strong signals, anger, hostility, fear, potentially direct or indirect threats, there is a tendency to put distance, even on the part of the immediate supervisor, from that individual, and a tendency to treat them differently than other employees, rather than applying discipline in a consistent and fair manner.
You want to tell me where to look this one up in the handbook?
What about his coworkers? Has anybody said anything?
No, not really. I mean, they go their way and he goes his. It's not like it's a case of sexual harassment or like he slugged somebody. I mean, the guy's just, he's wound too tight. You know, what's the policy on that?
Yeah, but this stuff about Robinson and Brubaker, I mean, what was that?
I don't know. That was the first I'd heard about it, but he's right. Robinson is a pinhead.
But on the other hand, we are Carl's third department. I mean, maybe the guy has a little problem fitting in.
Hey, look, you know, it's not a popularity contest. I mean, the guy does a good job. I don't know. It's just, he's not a happy camper.
Okay, so we both write an evaluation and you're gonna keep me informed, right?
Yeah.
You're sure you're comfortable with this? We could go to Human Resources and see if they have any ideas.
No, I can handle it, really.
Okay.
There is an underappreciation of the importance of that evaluation process and what goes into the evaluation. In fact, there's a fundamental tendency to pull away, soften the evaluation, and avoid confrontation. And the thought is that if I do this, I won't antagonize the individual. It'll keep things under control. Ironically, this is fundamentally wrong. It actually encourages the problem and makes it worse.
And things happen out there in society that, hey, it's just like in here. Things happen. Some things can be controlled. Some things can be spotted before it happens.
There are several early warning signs with regard to workplace violence. Right at the top of the list is direct or indirect threats of violence. These threats don't just get made to one individual, but get made to several individuals, and they have to be recognized. Another example would be a fascination for incidents of workplace violence. It's a sympathy for the perpetrator and a focusing and a fascination on the event that really should raise alarm.
This can also manifest itself in terms of a fascination with firearms. Not just firearms per se, but the use of automatic weapons.
Their killing power, their ability to instill fear in individuals, and often bringing that information and even the literature into the work environment.
What?
This guy went into his job and shot some of his co-workers. Listen to this. Police believe the attack lasted less than 3 minutes. Nevertheless, they estimate
He got how many people?
3 dead and 2 wounded.
And then don't tell me, he turned the gun on himself. Am I right?
Of course.
What did he use?
Let me see.
He had to have multiple weapons. Oh no. You see, you should have never mentioned guns to Carl. There he goes. He's gonna be here all day. Guy knew what he had to do. He used an assault rifle.
Carl, this guy killed 3 people.
An employee at the company for over 6 years.
Yeah.
You can't throw people away like that. Oh, man. They push and they push and they push, and then finally somebody pushes back.
Oh, Carl.
Come on now. You know how I do it? How would you do it? You're such a kidder. Go ahead, please tell us how you would do this. I would first take out Brubeck. Then I get down the hall to Robinson. I come back. I come back from Montgomery. And they'd be at their little desk dreaming up more stuff for me to do. I would just knock. Payday.
If someone begins to make a comment about feeling so personally injured that they might consider taking someone else's life, that's not a comment that any of us want to hear.
And these statements remarkably don't get registered. They don't get reported back to management so that we can do something about it.
It was wrong all the way around on both sides. That was wrong. Me for losing my temper and not trying to get things worked out. On the other hand, them for lying to me the way they did and then using me the way they did and then just discard me off to the side of the road like someone dumping a puppy off on the side of the road.
When an organization realizes that in fact they are faced with a legitimate threat, or at least a threat that is clearly designed to create distress and fear and intimidation in other people, often the first normal reaction is, what can we do to remove this person from our organization? And the list of alternatives and options gets read.
And unfortunately, sometimes we've seen the layoff process misused.
Got a minute?
Sure, Susan. Come on in. Hey, what's going on?
I think we've got a solution to the Carl problem.
Oh, really?
They're restructuring again.
Okay.
We're being placed under manufacturing, and we have to lose 3 slots. We lose the position, you lose the problem. Sorry, Carl. Nothing we can do about it.
What about human resources?
Well, it's not a dismissal for poor performance, it's a straight reorg.
Okay, sure.
So when they look at it, I don't think they'll have a problem with it.
We've just witnessed an effort to deal with situations without addressing the real problem. Management in dealing with this kind of problem needs to specifically deal with it. That means identifying it for what it is, taking appropriate disciplinary action, and notifying the resources within the company as to the problem that they have. If you don't do that, you can't deal with the problem, and the danger is there that it can come back and erupt.
I will live with this for the rest of my life. We all will.
Carl.
How do you measure the cost? In terms of pain and productivity?
You've already been to Human Resources.
Oh, yeah. I've already been laid off.
Well, look, If it's any consolation, I'm sorry. It's just the way the numbers came down, and well, you know.
No, I know how it works. You won't get away with it. None of you.
Wait a minute, Carl.
You don't throw people away like this. It's not how it works. You think this is over, huh? Let me tell you something. I'm not leaving alone. You got that?
Questions or comments? What do you think about that? Any reactions? A couple things I'd like you to know about violence in the workplace. One is, if you hear gunshots go off at work, don't be a hero, because 50% of the people who commit violence in the workplace go out of the place in a body bag. They either are killed by the police or they take their own lives. So that's not a time to try to reason with someone. So if you hear gunshots at work, you know, take cover, notify authorities. Okay, it's not a time to go up and try to reason with somebody with a smoking firearm. I'd like to just share with you some of the experiences I've had and let you know some of the ways you can prevent violence in the workplace. It gets back to that same word I started out with, is respect. Respect for your co-workers. What we found out over the years is for example, what we found out, let's say Debbie comes to work every day and say she's got a son that's disabled. Well, let's say he's a little bit slow and he's got a club foot. So she comes to work every day, you know, and you make comments like, well, hey, I bet old club footer's gonna make a great football or soccer kicker. And you know what? I bet you're planning on him going to Harvard, aren't you? You know, and comments like this. And the thing about it is, when we have a child that has that's different and has some special needs, and whenever people pick on that person and bring out those things, it really hurts. It really hurts. Because that person's having enough struggles. And the thing about it is, the probability of somebody going postal work is very low. But we found out that, you know, when people come to work day in and day out and struggling, and the whole team picks on them, in particular in those areas that are very sensitive, very sensitive. You know, some guy's going through his 4th or 5th divorce, you know, and all you guys going, we told you needed some of that Viagra. You can't keep a woman, you know. Making those comments like that, you know, the thing about it is we may think that's a joke, but the deal is sometimes that really hurts. So I would say to you, many times at work, try to be respectful, try to be kind, try to put yourself in somebody else's shoes. Don't make yourself targets, and don't pick on people when they're down and weak. I'd just like you to remember that. The other thing is, and here's one of the things that you can do at work. We've been very fortunate here in this end of the state and whatnot that there's not been any kind of a terrorist activity. And I would like for y'all to think about this. If you're out working in your work site and someone's in your work area that you don't have a clue who they are or what they're doing there, it doesn't hurt a thing in the world to go and let somebody know there's somebody in your work area that you don't know who they are or what they're doing. You don't have to be disrespectful about that. You can just simply go in and say, hey, has anybody got any clue who that guy is over there? Nothing wrong with that. Because many times, people who commit violence in the workplace, 60% of the time it will be someone who does not work here. Okay? It will be an outsider. And many times it will stem around domestic violence. It will be situations that was originated at home and is brought to work. And unfortunately, if some guy comes in here with a semi-automatic or automatic weapon to shoot his wife or somebody to shoot a boyfriend or something like that, guess what? They don't care who gets in their way. So if you see somebody in your workspace, let somebody know. If the people you work with on an everyday basis, all of a sudden if you see a big shift or radical change in a person's behavior, it doesn't hurt a thing in the world to let somebody know that. And it doesn't have to be in a disrespectful manner. You can just say, hey, I don't know what's going on with Debbie. She's always been a great friend and a great worker, but boy, she has just really shifted lately. That's not disrespectful. Okay. So y'all will know one another very well, and if you see a big shift in your working partner, you know, you might want to let somebody know that there is a big change. If somebody starts acting strangely. And just so you'll know, and I'll end up with this. This is a profile of someone who is most apt to commit violence in the workplace. And I'll use myself as an example so not to offend anybody. First of all, it's going to be a white male over the age of 40. Okay? Second of all, it's probably going to be someone that's a veteran and someone who is proficient with firearms. Not only do they have a lot of them, but they're very proficient with them. Also, if you check their record, they will probably have a history of substance abuse of some type. They will also have a history of a psychiatric disorder. You'll also find out they have a history of hating women. They do not like women. Okay? And it doesn't matter what you do for them, how many jobs you get for them, they will manage to lose it. They will lose jobs, and the thing about it is, you know why I was late this morning? That darn highway patrolman stopped me. I was only doing 70 miles an hour in that school zone, and he didn't understand I was in a hurry to get here. Now, if he hadn't given me that ticket, I wouldn't have been late. Always blaming other people, never accepting responsibility for themselves, not liking women. Okay? And everything, you know, blaming. The history of substance abuse, DUIs, psychiatric history, being put in Broughton. You know? Male, white male over the age of 40, proficient in firearms. And they have this one thing that Carl has, that sense of entitlement. You owe me. And that moral righteousness. You know, I'm right, you're wrong, nobody can do this. And taking everything so seriously. So I want you to imagine there's a person out here with an automatic weapon standing over here pointed at you, and they're under the influence of substances. They have a psychiatric disorder. And they think you've done them wrong. That is not the time to go and try to be a hero, because you'll go out of here in a body bag. That's the time for you to get out of the area and secure the place and let people know that there's something going on. It's not your job description. Okay? So that's a profile. White male over the age of 40, probably a veteran, proficient with firearms. You know, a history of failure, not being able to keep jobs, failed relationships, blaming other people, a sense of entitlement, and a moral righteousness about them. Got that? Okay. So, you see somebody in your work area, you don't know who they are or what they're doing there, let somebody know. If you see a radical change in people you work with, let somebody know about it. Okay? You don't have to be disrespectful about that. All right? That's what you can do. Questions or comments about violence in the workplace? Okay? And domestic violence plays a big role in it. Much of violence in the workplace comes from home. It's extremely expensive for violence in the workplace. Extremely expensive. It cuts out profit, productivity. People, instead of calling in sick, people call in scared. Like, I'm afraid to come to work. Okay? Homicide in the workplace is growing by the year. It used to be vehicular homicide at work. People got killed with machines or with equipment. Now it's becoming more and more people are killed by co-workers or people coming into the workplace from outside. Okay? It's a very growing crime. Okay? So don't be a part of it. Okay? Questions, comments? Okay, last one. Wow, looks like y'all are really enjoying it. Okay. Let me see, we've talked about violence, we've talked about sex, cultural diversity. I guess we better talk about drugs. Okay? So, this little topic is going to be on drug-free workplace. Okay? Why in the world would Blue Ridge Paper want a drug-free workplace policy?
Safety.
Safety. What else? Any other reason besides safety?
Prevention of lost time. Prevention of lost time.
Yes. Okay. Attendance.
Productivity.
Productivity. What does that all affect? Bottom line. Bottom line. Whether a company stays in business or not, you have to make a profit. We live in a capitalistic society. We don't make a profit, we can't pay people who work for us. We can't pay our bills. That's the way the system works. So we have a drug-free workplace policy so you can have workers who come to work, and we expect them to be sober and not impaired when they get here and be ready and able to work and do their job, you know, in a safe and a productive manner. So that's what the expectations are. Any of you got kids or grandkids? Imagine this morning, let's just say you're going to put them on the bus. Just play that part. You're putting them on the bus this morning to send them off to school. Now I want you to imagine as you take your kids out and you put them on the bus and they close the door. About 7:30 this morning. And as that bus starts pulling away down the road, you notice it's making one of those S patterns down the road. And that lady that's driving that bus, you would swear she was doing this to a cigarette. And then you see a wine cooler bottle go flinging out the side of she's driving. And this bus is going like this. You said, no, well, no, that couldn't be. No, that woman wouldn't be smoking dope and drinking wine at 7:30 in the morning, not with my kid on that bus. Now, while she's taking those kids over there to the school, you know, the teachers are over there in the lounge. You know, those teachers' lounge? You know? Now got their cocaine up on the mirror, you know, got some lines of cocaine, got them some joints rolled and some of that vodka, you know, there. They're bracing themselves for the day because these kids are coming, you know. So they're all having to get high or stoned. Your teachers are, you know. They're over there getting ready. Well, lo and behold, the kids get there, you know, and one of the teachers is too high and whatnot, and the parent comes in and they have a big ruckus. And they have to call the sheriff's department. Here comes two old burly guys over there, you know. They get out of that patrol car, and as they do, it's kind of tilted, and a liquor bottle, the fifth, rolls out. And you notice it's about all gone. There's just a little bit left in it. And as these two guys pass by, you know, smell like a brewery. They're big old guys with guns, you know. And they go in there and start to handle that incident, you know. One of them pulls out his billy club and starts to whack somebody, but as he goes backwards, instead of the person he intended to hit, he hits your kid with that billy club. Now your kid is injured. Didn't have anything to do with this. Now they're rushing your kid off to the emergency room over here. Well, the doc over there this morning and his nursing staff, the doc is demonstrating with running up Demerol between his toes. He likes Demerol in his toes. He likes that high feeling. It helps that God complex with him, okay? And the nurses are over there, you know, sorting through the pills they're supposed to be dispensing this morning out to the patients. And they're going, oh, look here. We got a Valium, Percocet, Darvocet. Wow, some Oxycontin. Let's try all this. So your doc's high back there on Demerol, shooting up Demerol, and your nurses are all out there, you know, on other psychoactive substances, and they're bringing your child to be treated. Now do you wonder why we have a drug-free workplace policy? Imagine if our society, the people that's placed in responsibility, if there were no restrictions on them. Does that make a little better sense to you why we have these things? You know? Old Ronald Reagan was the one that started this nasty mess, you know. the Omnibus Act, you know. When he thought maybe, you reckon those airplane pilots ought to be maybe sober when they're flying those planes up there, you know? And, you know, reckon maybe those guys that drives those 18-wheelers out there at 90 and 100 miles an hour up and down the roads, you reckon maybe they ought to be sober. And they found out by those drug-free workplace policies, they found out that when they initiated them in the workplaces, that productivity went up. That safety was better. They did a better job. So a lot of companies says, we might better put one of those in our organization. So the reason we have a drug-free workplace policy is so people can come to work and be sober, be responsible, and be able to do their job. That's the rationale behind it, okay? What is the most commonly abused substance in our society that is legal and it causes the most problems? Alcohol. 60% of the time, if a person has a problem with any kind of alcohol or drugs, it's always alcohol. It's still the predominant drug. You got that? Alcohol is a drug. We know that people who drink alcohol, 70% of the time, they also smoke pot and smoke cigarettes. It clusters. Okay? 90% of people who use alcohol use tobacco. So it just goes together. Now, what types in the drug-free workplace policies, there's different types of drugs. Alcohol falls under what category? Is it a depressant or is it a stimulant? Or what is it? Or hallucinogen? What is it? It's a depressant. Alcohol is a depressant. People who are depressed drink alcohol. Wonder what that does to them. Makes them more depressed. People who take antidepressants come in and tell me all the time, I take my antidepressant and that fifth of vodka every day. Well, guess what? One neutralizes the other. Okay? So alcohol is a big deal. And then the most second used drug in our society is what? Pot. Cannabis, THC, okay? Carbotetrahydrocol is the THC, okay? That's the second one. What category does pot fall under? Is it a depressant, is it a stimulant, or is it a hallucinogen? Hallucinogen. It's a hallucinogen, okay? And the thing about pot is, guess what? How long does it stay in your system if they do a urinalysis? How long does it stay in your system?
Well, it depends on how much you smoke.
No, generally speaking, how long is it going to stay in there?
30 months.
42 days minimum. So you're off from the South Seas on vacation, out of the country, you know, down in some little Tahiti hut down there, and you smoke a joint, and guess what? You come back to work 3 weeks later, and you have an accident, and they test you, and guess what? Kabang, test positive. Stays in your system a long time because it's fat soluble. And what we know about cannabis, one of the things it does, and the reason it's a detriment at work, is it's hard to concentrate and stay focused if you smoke a lot of pot. It's hard to stay focused. Right. And cocaine is another big drug in our society. Which does it fall under? Is it a depressant, hallucinogen, or a stimulant? It's a stimulant. Okay? People who take a lot of cocaine, you know, they're real hyped up, you know. Stay real busy, and they're usually pretty lean, you know. Don't see too many people on cocaine that has a pot belly, you know. So it's a stimulant, weight reducer, and whatnot. So those are the three main drugs in our society. Naturally, the one that kills the most of us is nicotine. You know, however, it's not illegal and it's not psychoactive. And even though nicotine is deadly and is the biggest killer of them all, it does not impair your ability to think or reason. The one thing that alcohol, cocaine, and marijuana has in common is it has the ability to alter the way you think and alter the way you feel. Okay. That's the reason we use it, because it usually elevates our mood and the way we think and feel. All right? So the other big category of drugs that we're faced with on a daily basis is prescription drugs. Unfortunately, our body and mind does not know the difference between whether or not a medical doctor prescribed this medication for you, or whether you got it out of grandma's medicine cabinet or you bought it off the street, it doesn't know where it came from. It has the same effect on you. Many people who get injured at work or an automobile accident or something like that, they have lower pain, lower back injury, which has very painful, or neck injury, which is very painful, and they will go to a medical doctor and they will try to alleviate their pain, and they will first of all prescribe some kind of medication such as Darvocets, Percocets, or Oxycontin of that nature. And the thing about it is then they will do surgery. And many times after surgery they will continue this medication. However, it's very easy to get hooked on it. Period. So, particularly when people's been out for surgery, particularly lower back injury and neck pains, they have to be very careful not to become addicted to the medications, because it's a real battle there of fighting the pain. You know, dealing with the pain and also having to worry about becoming addicted to substances killing the pain. Y'all got that? That's a big issue. We know, for example, families who have a problem with substance abuse use their medical insurance 13 times more than families that do not have a substance abuse problem. How could that impact your organization? How could that impact y'all? Where does that come from? That bottom line. Bottom line. So if you have half of your people here and they have substance abuse problems, your insurance premiums are going to skyrocket. Okay? Because the more your employees use the insurance, the more the premiums goes up. Is that correct, Debbie?
That is very true.
Okay. So to have healthy employees, it helps the bottom line. Okay? One of the first symptoms of substance abuse, you know, naturally is relationship problems. People who have problems with alcohol and other drugs, they usually have relationship problems such as marital problems. The other thing is, you will notice, what would you think would be another symptom of a person when they have a substance abuse problem? How would it show up at work? How would you kind of figure like, wow, this person...
Shaking.
What?
Shaking.
Shaking. What else? You have some personal experience with this.
No smoke or drink.
Okay. One of the
skin tone will change.
Right, that's true. But one of the very first ones that we can all see without any kind of training and whatnot is, number one, is it's hard to do your job if you're not here. Is that correct? So we find out, number one, is people just don't have a tendency to come to work as often as they do. And when they do come to work, what kind of condition are they in a lot of times? Hungover, late. And then when they get here, you know what the first thing they got to do? Go to the break room, the bathroom. You know? Got to go get straightened up, you know, get something to eat, you know, maybe shave, wash your face, and brush their teeth, you know. They didn't have the time to do that. So even when they do get here, they're not productive a lot of times, and they're hungover. And many times it's a morale issue, because this person lays out and nobody else is on your team, and you have to end up doing their work. You know, you can't depend on them. They're not dependable. They're not reliable. And many times too, if a person comes in hungover, they may make mistakes in their work. And they also are more prone to have accidents at work. You know? And the deal is too, if you get hurt at work, you can't be at work, and plus your insurance premiums, it drives them up. So it's kind of a vicious cycle. The other thing too is, what kind of a mood do you think somebody's going to be in when they come in here hungover? You know? Yeah, they might be a little more difficult to work with. You know? So bringing your addiction to work, you know, can be a detriment to the workforce. Okay? Now, what in the world should somebody do if they have a problem with alcohol and drugs? What should they do? Let's say it's not you. Let's say it's somebody in your family. What would be a good step if you thought you had a brother, a child, a spouse, a girlfriend, has a drink and a drug problem? What do you think would be a good step for you to take? How would you do that? To who?
Employee assistance program.
You don't have to do a lot of the work. You can just say, I'm gonna put the monkey on somebody else's back here. I'm gonna call the EAP and tell them what's going on and ask for some suggestions or advice here. Yeah. In other words, find out what I should do and what are my options. That's a good thing to do. Find out what I can do. Now, any of you ever heard of AA or NA, any of those things like that? They don't have any around this state, do they? There's one in every town in America. Okay, you've got AA, NA, and Al-Anon in every town. And if you have an alcohol and drug problem, they ship you off to New Mexico or somewhere for 6 or 8 weeks, right? Put it in the newspaper that you're out there and all that, right? No. There's help right here. You don't have to go very far. You can get help right here in Haywood County, Buncombe County. And another thing is you can get it and still work. You can go outpatient. You can get treatment that will jive with your shift work. You can get that worked in. So there's help available right here. Getting into inpatient treatment for substance abuse anymore is difficult. So don't worry about that. Your first attempt you're going to get is going to be outpatient. So you can do that and still keep your job. Y'all hear that? And it's effective. And I wonder if your insurance pays any of that. Yes. So y'all are very blessed, to be with an organization that has good benefits. So if you have a problem with alcohol or drugs or someone in your family does, you don't have to suffer in silence. There's help everywhere. It's everywhere. And the thing about it is, treatment for substance abuse is very effective if you follow the treatment regimen for 1 year. It's very effective. About 78 to 82%. Very effective. That makes sense to y'all. So you don't have to suffer in silence. And what's one of the worst things you can do if somebody has a substance abuse problems? What is one of the very worst things you can do? Ignore it. They don't have a problem. And then the second thing to do is enable them. Well, Joe's hungover. Let Joe go out in the warehouse and sleep a few hours. We'll do his job. For goodness sakes, don't tell the boss. Not ignore it, sweep it under the carpet, and enable that person. Do their job for them. Make excuses for them. Where's Joe? I don't know. I think he had to run an errand, boss. Covering up for people. It's a cardinal sin to do that. Because the deal is you're not helping the person. Because the illness is going to get worse. On the other hand, you can go to that person and tell them, like, hey, I care about you, Joe. I don't know what's going on, but hey, you need to do something about this. How can I help you? And it's okay to tell people, I'm not willing to cover up for you. It's okay to do that. You don't have to enable people. Because as a responsible person, it's up to you if you have an illness, to do something about it. And it's a very treatable illness, and it is an illness. Many people don't understand that when you have a problem with substance abuse, it doesn't have anything to do with how smart you are, how much education, how much money you have, whether you're married or single, black or white. It doesn't have anything to do with willpower. It's an illness. It's the same thing many people, check out of over here at Haywood Regional Hospital that's had a heart attack, and it's been a real inconvenience for everybody, plus a hardship and a lot of pain for them. And the first thing they're going to tell everybody is, I'm never having another heart attack. But the only problem is, it's an illness. And they don't know that. And they can do everything in the world they're supposed to do, like diet and exercise and reducing their stress and all that, but they can still have another heart attack. And it's the same thing with substance abuse. When it becomes a problem, it's an illness. Okay? It's an illness. And just so you'll know, there's different categories of people who drink. What's a social drinker? How would you describe a social drinker? What would be a definition of a social drinker?
When they get socially drunk.
That what?
Get socially drunk.
Socially drunk. How often do social drinkers drink?
Out with friends on the weekends, maybe once or twice during the week, not a lot.
Social drinkers don't drink very much. For example, if you, a social drinker, they said, hey, we're going on a cruise, it's gonna be for about 9 months. The only problem is, there's no alcohol whatsoever, or pot. Well, a social drinker would say, so? But now, a person who likes to drink, what would they say? They're not going. So social drinkers don't need a drink, and they don't want to drink. They only drink in social situations. Drinking's not a big deal to them. And then in our society, we think social drinking is people who goes home every night and has a cocktail or a highball or a beer. But unfortunately, as time goes by, then that is not social drinking. You know, that's daily drinking. And you'll find out if you don't give your body that drink that you usually give it every night at 6 o'clock, it will knock on your door and say, hey, where's that drink? Because if you don't, it starts getting irritable and cranky. You know? That's right. You know? Another thing is social drinkers don't get drunk. You know? They don't. No, they don't get drunk. They don't have blackouts. They don't get DUIs. And just so you know, I'll share this information with you. When a person gets a DUI, driving under the influence, the probability is 85% of the time that they already have a serious problem with alcohol and drugs. If you get your second DUI, it gets up to 99.9 percentile. You have a serious problem with alcohol and drugs. One of the best ways to know whether or not you can handle alcohol is to look up your family tree. Just look right up. And if your dad, your mom, your brothers, your sisters, aunts, uncles, grandfathers, grandmothers had a problem with alcohol, it just passes right down the family tree. It's in the bloodline usually. Does that make sense to y'all? So if you look around in your family and there's been a lot of problems with alcohol in the family, it means probably if you use it, you will also have that problem. That make sense? No? Doesn't make sense? Why does that not make sense?
Mom and dad drunk, both of them drunk. I've never drank in my life.
Okay. All right. You ever heard of skipping a generation?
Yeah, there's 9 of us, so I think it's a choice, personal choice.
Okay. Well, I definitely agree with you that drinking or not drinking is a personal choice. What I don't agree with is if you choose to drink, is the impact it will have on you. Because some people just have the predisposition to drink. If they drink, it doesn't have any effect on them, and it's difficult for them to develop an addiction to it. Whereas other people, because of their bloodline and their genes, if they choose to drink, they will just about develop a problem with it. So your best defense is not to drink. Choose not to drink. Does that make sense? Okay. Yeah. So it is, you can choose to make a personal choice not to drink or to drink. If addiction runs in your bloodline and you choose to drink, the probability that you develop a problem with it is much higher than if it's not in your bloodline. Okay? 80% of people who use alcohol never have a problem with it. Usually runs in the bloodline. Okay? Now, so I hope you heard this. If you do happen to have a problem with alcohol or drugs or somebody in your family, know that your Employees Assistance Program is there and willing to help you with it, to guide you and direct you on that. That people bringing their problems with alcohol and drugs is very expensive at work. It runs up your insurance premiums, attendance, safety, efficiency, productivity, affects the bottom line. All right? So, if you do happen to have a problem with that or somebody in your family, please feel free to call us. We'll do whatever we can to assist you with that. The only shame about having a substance abuse problem is not doing something about it. Okay? Questions or comments? Everybody okay with this? Okay. Now, what's your tolerance? Now, I understand they can smoke a little pot or maybe have a beer during the day. Is that true?
No. Zero tolerance.
Zero tolerance. Okay. Well, one last thing, I better tell you this because somebody will use this on me. People come in, they have a positive drug test for pot, and you know whatever, people always tell me when that happens? Well, I wasn't smoking it. I was just in a car or a truck or in a room, and it was passive smoke. Yeah. Well, you know, all the experiments they've done, you know, putting people in rooms like that, and they can't get them to come out positive for marijuana through passive smoke. Never been able to do that. So the probability is, you know, if you have a positive drug test for cannabis, you've been smoking or ingesting marijuana in some form. Does that make sense? And another thing is, when I ask people about their drinking, do you think I've ever met anybody that's ever had more than 2 beers to drink? No. Never have talked to anybody that says, yeah, I had 3 or 4 beers last night. No, I had 1 or 2 beers. You know, never talked to anybody that's had more than that. And just so y'all will know, if you're a healthy person and you have a body weight of 160 pounds, you can drink 1 3.2 beer per hour and never blow a .08 on a breathalyzer, because your body will process that amount of a 12-ounce 3.2 beer in 1 hour. What happens is when you have 3 or 4 beers in that 1 hour, your body cannot process it and get the alcohol out of your system. And that's when your blood alcohol content starts going up. So, okay? And Debbie says you're not allowed any beer here or any pot. Is that correct? Or liquor? 0 tolerance. And the reasons for that is so y'all can come to work and do your job and work safely amongst each other and effectively. And keep your insurance premiums down. And hopefully make a profit and get bigger bonuses and bigger paychecks, hopefully. So if one of your friends at work has a problem with alcohol or drugs, please don't enable them. Please don't enable them. Please let them know you care about them and say, hey, won't you address that? I can't cover up for you. Okay? I thank y'all for your attention, and good luck to you on your new jobs.